Now I will discuss about human respiratory muscles. Human respiratory muscles drive breathing by changing the volume of the thoracic cavity, thus creating pressure gradients that move air in and out of the lungs. The primary muscles of inspiration are diaphragm and external intercostals. Diaphragm is the dome-shaped muscles located below the lungs. When it contracts, it flattens downward. This increases the volume of the thoracic cavity and thus environmental air rushes inside the lungs. This is the phenomenon which we technically called as inspiration or inhalation. Reverse happens when diaphragm relax. When diaphragm relax, the diaphragm again becomes dome-shaped. This decreases the volume of thoracic cavity and thus pushes the air back to the environment. This is the phenomenon which we technically called as expiration or exhalation. On the other hand, external intercostals are the muscles located between the ribs. When they contract, the rib cage is elevated upward and outward. When the external intercostals, that is the muscles which are located between the ribs, they contract, the rib cage is elevated outward and upward, which expands the width of the thoracic cavity. This increases the volume of the thoracic cavity and thus the environmental air rushes inside the lungs, which is nothing but inspiration. Reverse happens when the muscles relax. So, what happens when inspiration takes place? When the diaphragm gets contract and the external intercostals gets contract, then the rib cage is elevated upward and outward. As a result, the volume of the thoracic cavity increases. Then the environmental air rushes within the lungs and this is called inspiration. Reverse happens when these muscles relax, when the diaphragm relax and at the same time when the external intercostals relax, then what will happen? The thoracic cavity contract and thus the air inside the lungs gets expelled out into the atmosphere and this is called expiration. Now I will discuss about the accessory muscles of inspiration. The accessory muscles of inspiration are involved during forced or a deep inhalation only. They have no or negligible role during quiet breathing, that is normal breathing. These accessory muscles of inspiration are scalens, sternocleidomastoid and pectoralis minor and major. That is pectoralis minor and pectoralis major. First I will discuss about scalens. Scalens are located in the side of the neck. There are three main scalene muscles: anterior scalene, middle scalene and posterior scalene. These muscles elevate the first two ribs when they contract. This happens during forced inspiration. Scalenes are relatively inactive or contribute little during a normal breath, that is quiet respiration. Now, sternocleidomastoid are located in the anterolateral part of the neck, that is on the front and side of the neck. There are two sternocleidomastoids, one on each side of the neck. When both sternocleidomastoid muscles contract, they can help elevate the sternum and upper chest during forced inspiration. Sternum means the breastbone. So when both sternocleidomastoid muscles contract, they can help elevate the sternum and the upper chest during forced inspiration. Now, pectoralis major are large superficial muscles covering the front of the upper chest. Actually, this muscle is commonly called the chest muscle. When the upper limbs are fixed, this is to be noted that when the upper limbs are fixed, contraction of pectoralis major helps elevate the ribs during the forced inspiration. Again I am saying, here it is to be noted that its respiratory action is most effective when the upper limbs are fixed. On the other hand, pectoralis minor are located deep to the pectoralis major in the upper front part of the chest. Pectoralis minor is much smaller than pectoralis major and is not normally visible externally because pectoralis major covers it. When the scapula is fixed, Contraction of pectoralis minor elevates the third, fourth and fifth ribs, helping in forced inspiration. So it is to be noted that its respiratory action is particularly relevant when the scapula is fixed. Now I will discuss about the muscles of the expiration, which are concerned with forced expiration. The muscles of expiration are internal intercostals and abdominal muscles like rectus abdominis, external and internal obliques, and transversus abdominis. Here it is to be noted that contraction of external intercostals are related to quiet inspiration, that is normal inspiration. But contraction of internal intercostals are related to forced expiration. Again I am repeating. Contraction of external intercostals are related to quiet inspiration, but contraction of internal intercostals are related to forced expiration. When the internal intercostals contract, ribs are pulled downward and inward, resulting in decrease in thoracic volume. This forces the air to move out. However, in normal expiration, which is known as quiet expiration, the internal intercostal muscles generally relax, thus decreases the thoracic volume. Here we must understand that quiet expiration is mainly passive due to elastic recoil of the lungs and chest wall. Now let us know how abdominal muscles are related to forced expiration. The abdominal muscles contract to push visceral organs upward against the diaphragm, decreasing the chest volume. This results in forced expiration. Now let us understand the process of quiet breathing, which involves quiet inspiration and quiet expiration. That is normal inspiration and normal expiration. Quiet inspiration is an active process requiring energy and muscle contraction. The diaphragm and the external intercostals contract, which enlarge the thoracic cavity, as we have discussed earlier. The increased lung volume lowers the internal alveolar pressure below the atmospheric pressure, thus the environmental air rushes into the lungs in the process called inspiration. As mentioned earlier, accessory muscles assist only during deep or forced inspiration, and they have no role or negligible role in quiet inspiration. On the other hand, quiet expiration is normally a passive process, which is driven by the elastic recoil of the lungs and chest wall, as primary respiratory muscles like diaphragm and external intercostals relax and return to their resting positions. This results in decreased thoracic volume. Thus, intrapulmonary pressure rises above the atmospheric pressure, which pushes the air out from the lungs. This process is called expiration. However, forced expiration becomes an active process, engaging abdominal muscles and internal intercostals to expel out air. So, quiet expiration is a passive process, but forced expiration is an active process. So we can conclude that it is not that we inhale, therefore our thoracic cavity expands. No. Rather, our thoracic cavity expands, causing us to inhale. Similarly, it is not that we exhale and therefore our thoracic cavity contracts. Rather, our thoracic cavity contracts, causing us to exhale. So this is all about the respiratory muscles and how they are responsible to carry out the process of inspiration and expiration.